Hi, my name is Michael Morris. In January of 2023, I was diagnosed with prostate cancer, and at the very end of February of 2023, I underwent a radical prostatectomy. I wanted to make a video series to share some of the things I learned. One of the things I found about being diagnosed with cancer is all of a sudden I'm overwhelmed. I was overwhelmed with stuff I needed to know and things that I needed to learn, and it's a big, huge learning curve that you go through, and it's pretty tough. So I just want to share some of my experiences. They may resonate with you. I certainly have some ideas and some thoughts. I want to make it very, very clear that this should not be construed as medical advice, nor should it persuade you one way or another as to treatment choice. You should discuss this with your doctor. If you're not getting satisfactory answers, then you should consult with other doctors and other medical professionals to help you gather the information and have the knowledge to make the best decision for you in your situation. So I just really want to make that very, very clear. Nonetheless, I learned some stuff along the way and I want to talk to you about it. This particular video is going to be about penile care after prostatectomy. And I'm going to call this watering your garden. There's an obvious pun here because there's a lot of urinary control issues that happen right after you've had surgery. But this is an analogy that I want to use, and this is an analogy of our backyard. My partner has worked as a banker and then got tired of banking and went back to school and got an engineering degree and is now an electrical engineer. And he just has such structured jobs. And it's so interesting to see him come home and work in our backyard. That backyard is his, and he's a serious gardener. And he is a creative gardener. He lets things grow wild. He'll plant seeds and say, let's just see what happens. He'll let stuff sprout up in the middle of the yard. It's just amazing. All I can say is I'm glad we don't live in a neighborhood that belongs to an HOA, because we'd always be in trouble and be getting fined. But what he produces is very, very beautiful. Also, in our garden, we compost, and we actually eat a lot of fresh fruit and vegetables, and so we have really rich compost. And my partner turns that compost into soil. We live in Massachusetts, which is one big giant slab of granite. So as soon as you dig down a couple of inches of earth, you're going to hit solid granite rock pretty much anywhere you go. And so it's hard to keep the soil rich. It rains and the soil leaches away. And so we're constantly replacing the soil. But since we're replacing the soil from our compost, there are seeds in it. And every now and then something will just sprout in the middle of our garden that we didn't expect. So we call it our volunteer garden. One fall I went out and there was a giant acorn squash growing in the middle of our yard. And I kept thinking, how did we miss this with the mower? But there it was. It just grew up. We also have an apricot tree that grew up from a pit that we had put into the compost. So what I'm trying to get at is, as you are recovering, there are a lot of things you need to put together. You need to put together urinary control. You need to find some sexual satisfaction. And your whole sexual system has kind of been broken down from an RP, and you have to work at it to kind of get things going back together again. And then you probably will be facing erectile dysfunction and figuring out ways that you can work with that. So there's a lot going on. And I have to tell you that after having my RP, I was in no mood to do any of this. I was in mourning. I was in grief. My life had changed. A part of my body had been taken from me, and my sex, my ability to express myself and to feel sexually, had been largely taken away from me. And I had to figure out what I could get back. But I certainly was in the mood to start exploring a lot of things. The way I like to put it, and it's interesting, I think a lot of men's clinics or men's hospital units do this, is once you've gone through RP, then they immediately want you to move on to their ED clinics and their survivorship programs, which is all well and good, but I wasn't ready for it. I equate it with having a pet, a beloved dog, family pet that lives to be 17 years old, and finally your dog dies. And the next day you go out and get a puppy, and it makes everything okay. And by the way, I have lots of friends who do that, and that works for them. And I don't judge them. If they can do that and make that work, then more power to them. But I'm not that kind of guy. I have to grieve first. I have to think about this. I have to understand what's going on, and I have to slowly ease back into things. So if you're that kind of guy, if you're in the same problem, I don't feel good, I don't feel like doing anything, I don't want to be happy about this, then at least take care of your penis and at least work on your urinary control. And so watering your garden, this is what we're going to talk about here, is things you can do that are not necessarily a full court press towards getting an erection, but things that you just absolutely need to do to keep your body healthy for when you get to that point, when you're ready to figure out how to have orgasms, full orgasms, or how to have erections, or whatever else it is that you want to achieve sexually. So until that time, at least keep your body healthy. And so we're going to talk about a few things. Number one in this list is pumping. I strongly encourage you to do this every single day for the rest of your life. The whole goal here is getting blood flow into your penis. Once you have had, the cavernosa veins removed partially or fully, or maybe you had a nerve-sparing RPA, but even then, those nerves can be traumatized for a very long time. Sometimes it takes a long time for them to get up and running again. And so while that's going on, you do not have blood flow going into your penis. And like I said, if you have those veins that don't exist anymore, you'll never have blood flow going into your penis. You're always going to have to work with this. And so pumping once a day is a really good thing to do. If it doesn't feel sexy, that's okay. Just do it. Just do it anyway. Another thing to talk about is turtling. And this is a term that I saw used. I hadn't heard before, but as soon as I heard it, I knew immediately what it was, which is when your penis sort of shrinks up. It recedes inside of you. It pulls back a little bit. And some men kind of joke that when they turtle, it's almost like they're uncircumcised again because their penis has receded so much that the flesh around their penis is very fleshy and sort of resembles a circumcised penis, an uncircumcised penis, sorry. And you also remember Seinfeld and George Costanza getting caught being naked in the waves, and everyone saw him, and he kept saying, "Shrinkage, shrinkage. It's cold out. That's why I'm so small." And if you're experiencing that, and you will after an RP, I think it's important to get blood moving in that area. I mean, that is why you're experiencing that. It means that blood is not being supplied to that area. Let's talk about this a little bit. Another little fun fact that I don't think that people know. I didn't know it until I'd gone through this experience. Is you have 2 to 3 erections per night on average, just in the middle of the night. Nocturnal, you're not aware of it. You're asleep. You get a hard-on. The reason for this is to keep blood supply to your penis. Your body constantly replenishes the blood to that area to make sure your penis is healthy. So you're going to have to do that. So when you turtle, you may not have the opportunity to just quickly grab a pump, and plus you should only be pumping about once a day. But when you turtle, you can reach down in your pants and jiggle your goods, and you can rub in your perineum area. You can rub along your thighs, anywhere in that area. Pull on your penis, pull on your testicles. Obviously, you can't do that while you're walking through a Target store, but you can do that at home when you're in private. And if you're out and it's bothering you, I find it very uncomfortable to be that receded. I slip into a men's room and go to a stall and just give myself a couple jiggles to make sure my penis kind of comes to full blood again. This is really, really important. This will help you restore nerves. If there's any hope at all for you to restore feeling to your penis and responsiveness and possibly even erection, you need to be doing this stuff all the time. That blood is bringing all sorts of good things to keep your penis healthy. So I really, really, really recommend you do that. Also, try masturbating. Most men who've gone through an RP find orgasms to be very strange. They find masturbating and arousal to be strange and disruptive. Sometimes you'll feel aroused and all of a sudden it'll just stop. It's like, where did that go? Where does this leave me? I'm horny and all of a sudden I was getting somewhere and then all of a sudden, boom, it's gone. A lot of that's going to happen at first, and a lot of it's not going to connect to really, really good orgasms or sexual responses from you. So nonetheless, I encourage you to try it, to give yourself a wank every day if you can. It's just really, really important. Your penis is part of you. Your penis is your friend. Most men have a name for their penis. They almost regard it as a character, like their buddy. And let's face it, you and your buddy, Mr. Happy or whatever you call it, have been through some really good times together. And even though your guy is suffering right now, he's still a part of you, and you need to take care of it. Take care of your penis. So really, really encourage you to think about this. Hope this isn't too intimate to talk about, but you want to get yourself in the best shape you possibly can when it comes time to try, different techniques for getting an erection, and try to have a complete sex life with your partner and also with yourself individually. And that's one last thing I just want to toss in there before I go, is a lot of literature pushes you towards doing this with your partner, having your partner share in this. And I think you should be doing both. For one thing, I'm just not willing to drag my partner through a lot of trying and a lot of failing. I was going to sort of take that failure on my own and just sort of deal with it. But also, there's a lot of grief. Every time I tried something, I would remember what it felt like when I could do that. When I had a fully operational penis and I could do that. And now it doesn't happen. It doesn't respond the way it does, and it hurts. It hurts so much to realize that day has passed, and from here on forward, I'm going to have to find a new way. And that's a significant loss. It's grief, much like losing a friend, or a relative or something like that. And so it's a lot to take in. So I just encourage you to keep yourself healthy and take your time and just relax about this. But hold on, I forgot about one thing that I really need to talk about, and that is about pelvic exercises. Do your Kegels. Commit to doing your Kegels. Do them all the time. Do them every single day for the rest of your life. This is important. It's an exercise that's going to help you with urinary control, but there's also some data that shows it helps with sexual recovery. There are some more complicated programs that you can do, and I'm going to leave a link to a PT who I think has a great series on improving your pelvic floor, and she's just very likable. I think you'll enjoy that series, so I'll include that in the comments below, a link that you can go to. But it's extremely important, and it's extremely important to get it through your head that this is a rest of your life kind of thing that you need to do every single day. And by the way, it's really easy to do. You can do them without anyone even noticing. You can be in public and you can do your Kegels. I actually find that there's a certain leg press that I do at the gym, and I can do my Kegels at the same time. And for some reason, it helps me focus on the Kegels when I do this leg press at the same time. So I've learned to do that. But every single day, at least one set of them. But you should be doing them all the time. Every time you think Kegel, you should be sucking up those muscles in your pelvic floor. Extremely important. So make sure you add that to the list. So going back to the analogy of watering your garden, you're not sure what's going to grow and where it's going to grow. Part of sexual recovery is you're just going to have to take with what sprouts, and you're going to have to work with that, and eventually you will be able to get back to something that is satisfactory in terms of a sexual life. It won't be like you had before, but you'll have some things to work with. But probably coming right out of surgery, it's just a mess. You're feeling some things, you're not feeling others, and you're trying to figure it out. So while you're trying to figure it out and while you're grieving, water your garden. Just keep things going. Make sure you're keeping blood supply going. Make sure you're doing your Kegels. Make sure you're having some sort of sexual interaction, if only masturbation. Make sure you're doing these things to prepare yourself for the day when you can really get in there and really work with it and bring yourself to some place, to a much happier place. So thank you very much.